The technologist's voice is very important. It is probably the second most important voice in the room behind the interventionalist, but maybe as important as the interventionalist in some cases to point out when things are amiss, when things aren't quite right, when best practices haven't been adopted, because the technologist is in the unique position of dealing with one or several interventionalists, and he or she is the only person who has seen best practices across the board at that institution, maybe at other institutions. And so their voice is going to be important to ensure that each practitioner adopts best practices.
Very important that the way you set up your room, you get all the persons involved and try to figure it out where you're going to be setting up so you don't get on the way of anybody, especially if it's done with anesthesia, since it requires quite a bit of equipment to be in the room, to make sure you're on the other side, depending on what organ are you working on and how many lesions you're going to be doing. Setting up the microwave machine, it's really easy. You just got to have the supplies there, and that everything is ready to go. And make sure you do this before you start any procedure. What we actually do is we scan patients on a 5mm intervals, and this is just to minimize radiation. Also, just set up for the organ that you're going to be working on. Now, don't overscan, and make sure your field of view is just to cover that area. Retro-recon these images to a 2mm for the AC to be able to see it better. Remember, some studies might require IV contrast. Make sure the series that you have with IV contrast and you are able to see those lesions are target. Supplies are very important in the room. Make sure you have everything ready. You don't want to be running from one place to another in the middle. Many physicians require biopsies before or prior to ablations. Just make sure everything is ready, you have everything needed, all the people are connected, and you're good to go.